Hello again, everybody. This is Dr. Brian Langlois, the medical director of the Pet Pantry of Lancaster County, as well as the immediate past president of the Pennsylvania Veterinary Medical Association. And we're jumping back on here with another update as far as COVID-19 and your pets are concerned, as I am sure a lot of people have now seen or will be seeing probably in the next 24 hours, the reports out there that there were two cats, house cats, in New York State that did test positive on the confirmatory test for what we're calling SARS-CoV-2, which basically is the virus that causes COVID-19 in people. Now, I realize that this is the first time in the US that we have seen positive cases come up in house cats. We did have the cases in the Bronx Zoo of the larger cats, the tigers and a couple of lions, but this is the first time we are seeing it in house cats. It's probably going to lead again to some concern among cat owners if this is going to turn into a major concern as we move through this pandemic. And we wanted to jump on here again and say that right now, there really is no evidence to change any of the recommendations that we are currently making in regards to COVID-19 and your pets. These two cats did show some mild symptoms of COVID-19, so they did have a mild cough, they did show a little bit of lethargy, maybe a little bit of inappetence, but they are on the road to recovery. So it kind of says to us in a lot of these cases that we're seeing, if a cat were to become infected with the SARS-CoV-2, it doesn't seem to hit them as hard as it does humans. They do seem to be able to recover pretty well, and there doesn't seem to be any concern for any long-term damage or long-term care concerns when it comes to these cats. There is also still no evidence that this virus can be transmitted from these cats to humans. We have obviously confirmed at this point through science studies and things that the virus can be transmitted from humans to cats, and this is something that we in the veterinary profession and the research world did kind of expect, because as we've talked about previously, the ACE receptors that are in the respiratory tissues of cats are very similar to the ACE receptors that are in the respiratory tissues of humans, so it doesn't really surprise us that cats potentially could become infected with this SARS-CoV-2. That being said, again, it's not a cause for major concern. You do not need to worry about getting rid of all your cats. You do not need to worry about surrendering your cats to shelters. You do not need to worry about the strays that are on your property or the ferals that are around. We do not want to see mass surrenders of cats to shelters. We don't want to see people taking matters into their own hands in regards to trying to get rid of the feral or stray cat populations that may be around. They have done tens of thousands of tests on cats looking for COVID-19 and on other species as well, as they look to validate certain tests for animal testing. And these are the first two cases that I am aware of in the United States that have come back positive. And both of these cases appear to be cases where these cats were with either a confirmed COVID-19 positive person or somebody who was potentially an asymptomatic carrier of the disease. So it is not a case of where this is widespread or spreading like wildfire through the feline population. It's not something that everybody needs to worry about. All of that being said, really our recommendations are not changing right now as far as what we've said in the past, which is basically, practicing good common sense hygiene measures around your animals, washing your hands after feeding or playing with them, not sharing food with them, trying to avoid some of that really face-to-face contact with your cats if they enjoy licking your face or kissing your face, things like that. We know that's difficult, especially in times of quarantine and stay-at-home orders where, sometimes your cat is all you've got. But really just trying to, maintain that distance a little bit just to provide a safety buffer for your cat. And again, it's out of an abundance of caution more than anything else. Now, our recommendations as well are not changing. If you are positive for COVID-19 or suspected of being positive for COVID-19, we really do recommend that you try to have a friend or family member take your animals and take care of them for a week or two while you recover until you're basically cleared by your doctor. We realize that cannot happen in every case, so again, those good hygiene measures come into place, really just trying to maintain a little bit of distancing with your pets if possible during that time and not taking them out in public, keeping them in your home. All of those common sense measures, and all of those measures, of course, can be found on multiple websites. The best ones obviously are the CDC website, the Pennsylvania Veterinary Medical Association website, which has a whole section dedicated to COVID-19, as does the American Veterinary Medical Association website, which also has an entire section dedicated just to COVID-19 coverage and research. So again, we wanted to jump on real quick and just kind of talk a little bit about the latest news of these cats coming back positive. Again, nothing to worry about, nothing to become concerned about. It is not changing any recommendations we are making making at this time. And your cats cannot get you infected with COVID-19. As I said before, there is no scientific evidence to show that at this point. If at some point that were to change, we, of course, as veterinarians, will be the first ones to be out there to tell you that we are changing our recommendations. But until that time, if you do have any questions or concerns, if you suspect your cat may be infected with COVID-19 or is showing upper respiratory signs, please contact your veterinarian first. There are a lot of different respiratory viruses and bacteria out there for cats that can cause colds and cold-like symptoms and coughs. You do not want to jump right to the fact that they've got SARS-CoV-2. Trust me, there are a lot of things that are much more likely to be causing respiratory infection in cats, and COVID-19 or SARS-CoV-2 is pretty low on that list. So you do want to definitely check with your veterinarian, and really veterinarians are also not going to be offering widespread testing for COVID-19 amongst your cats. So you can't just ask for a test to be done on your cat. There still are kind of criteria that have to be met, and it has to be done in consultation with the local, state, and potentially national veterinarians to determine if the cat really should be tested or not. So we wanted to make that clear as well. You're not going to be able to get your cats tested right away. And also, for those that may be wondering this point, the testing that we do on animals, the animal type test, is not the same as the human test. So we are not sacrificing human testing in any way for the purpose of testing some cats that may be showing signs. They're two totally different tests. The ones that we're currently using on animals, we cannot use on humans anyway. So do not worry about that as well. So as always, if you have any other questions, feel free to reach out to your local veterinarian. We have the most up-to-date information, and we will, of course, be back to update you with any new developments that may happen as this COVID-19 pandemic progresses. Until then, this is Dr. Brian Langlois with the Pet Pantry of Lancaster County, as well as the Pennsylvania Veterinary Medical Association, hoping everybody, including your pets, stays happy, healthy, safe, and sane as possible during these stay-at-home orders.